Good morning, good morning, good morning. My name is Angel Anderson, and today I have Dr. Moreno. Dr. Moreno on the line or live, I should say, to talk a little bit about medical marijuana, the indications of medical marijuana. How are you today, this morning, Dr. Moreno? How are you?
Doing great, thank you. How about you?
I'm doing
Mhm.
fantastic. So, tell us a little bit, what do you mean about indications of medical marijuana?
Yeah, today we're going to pretty much discuss where is medical marijuana indicated, what makes it legal for medical use in pretty much most states. Every state is different, and we'll go over those indications and what different types of medical marijuana are available and how they're used.
Awesome, awesome, awesome. We lost Dr. Moreno for a second. Let's bring him back into the line. Let's see what's going on. Let's see. No worries, sir. I'm gonna bring you back on the screen. As you know, we're doing this live, so if we have any technical difficulties, we're gonna let you know on the post. But we're gonna bring Dr. Moreno back into the line. I don't see your feet, sir.
Okay.
There you go. So
Uh,
let's now we see you. Beautiful. So we were saying, Doc, that you were going to share, especially if you live in Florida, correct?
Yeah, in general, right now there's about 33 states that have legalized medical marijuana for medical use. There's a few others that are recreational on top of the medical, but today we're going to concentrate on the medical use of medical marijuana. And just to give you a slight background on cannabis, which is the more appropriate name for marijuana, cannabis actually has been around for as long as we know, greater than 12,000 years. It was first noted in Central Asia. At that time, it was also around that time, actually around 400 BC in China. They found that it was being cropped or used for aesthetic reasons, more for anesthetic reasons, for surgeries, for pain.
Yes, sir.
And then they also found it that in India, the Ayurvedic medicine, which is their form of their holistic Eastern type medicine, they used it a lot in ceremonies to help relieve anxiety and also during things that had to do with pain, any kind of procedures. So it's been used for a long time, for medical reasons, especially for anxiety and pain. And so it was actually introduced in the United States around the 20th century, the beginning of the century, around 1910 to 1911. This is when actually in Mexico, from Mexicans from during the Revolution, the Mexican Revolution, they actually immigrated into the southwest border of the United States. And unfortunately, at that time, here in the way it was introduced, these guys were kind of rebels. They smoked marijuana or cannabis, actually, and they were frequently associated at that time with people that were bad. People that caused a lot of damage and seduced children and caused a lot of, like murder sprees and stuff. So they actually changed the name to make it more criminalized to marijuana. It sounds like Juana, it's sort of a Spanish name. Marijuana, similar to Mexico. So they actually made it sound like it was more criminalized by uh, changing the name. So it really was cannabis. So as you can see, it got a bad start in the U.S. When it first came in, turn of the century, 20th century, and by 1915 it was first considered outlaw or illegal in Utah, but by 1931 most states in the union considered it illegal, and then and so you know, unfortunately in the United States the um, the law consider all cannabis plants illegal. There's two types of plants. There's sativa L, marijuana, or just hemp. The more scientific name is sativa L, and that actually doesn't have any psychoactive type of properties. It has more CBD, and but it has a lot of fibers that are used in industry for clothing, textile. It's a lot of the oils are used for cosmetics, so it has more of a organic type use. But the other type of cannabis plant is called indica and sativa, and those are the type that are more associated with the psychoactive uh, profiles that we hear about cannabis. So they didn't distinguish the difference between the different two types of cannabis or sativa plants. And now we have a farming bill that's going to allow us to grow hemp in the United States. People can actually farm, more for, like we said, organic reasons, textiles and oils and things that are. But unfortunately, back in 1937, marijuana tax act was introduced, and it was under the regulations of the DEA, the Drug Enforcement Agency, and that's where it became illegal and to possess marijuana. So unfortunately, the feds right now consider marijuana as a class one type of um, agent, or we should really be calling it cannabis, and that's considered similar to heroin, or cocaine. It's basically a Schedule One. They consider it something that doesn't have any medical use, that has a high potential for abuse, and has no safe levels. So unfortunately, the feds are not in line with the states, as far as the use of marijuana or cannabis. Now, back in 1942, though, the American Medical Association, which was pretty big at the time, and even today, tried to introduce cannabis as part of a U.S. pharmacopoeia, which is the agents for medical use. But unfortunately, it was shut down. So so now we're going to kind of discuss a little bit of what the what is the what we call endocannabinoid system. Endocannabinoid system is a series of chemical signals and agents that are produced in the brain that help modulate or coordinate different functions in the brain, including or in the body, brain and body, like motor function, appetite, mood, sleep, and immune function. And every day we're finding different things that activate the system. It helps sort of balance out neurotransmitters and hormones, and it's sort of an internal network that signaling of chemicals and that are used for to balance out our bodies and immune system. And two of the main ones of the endocannabinoid system chemicals, one is called anandamide, and the other one is called AG2. And unfortunately, as we get older, these two endocannabinoids, which are produced by our body, they become less as far as quantity, and then we start having symptoms of not balanced appetite, sleep, mood, and um, and that's when we turn to cannabinoids, which is the plant versions of those endocannabinoids, the same chemicals that we make. And fortunately, these cannabinoids have receptors that are actually activated by our endocannabinoid system. So our body recognizes these receptors. And the two main receptors is one called CB1 and CB2. CB1 is primarily um, activated by one of the cannabinoids called THC, which is one of the psychoactive cannabinoids that can cause euphoria, increased mood, um, decreased pain. It's used a lot in the cancer and HIV because it helps with nausea, vomiting, that we get sometimes from medications or chemotherapy. It helps with anxiety, helps with appetite. So it has a lot of effects that are beneficial. But again, you have to balance these things out. Too much of one thing could be bad. So you balance these out with something called CBD2, which is CBD, which acts on the other receptor, CB2. CB2 receptors are seen more in the body, not just where the CB1 receptors are more in the brain. So the CBD2 receptors are more like for inflammation in the body, and they help, coordinate things with CB1. And that's where we get the non-psychoactive CBD that we see talked a lot about. And for that, you don't have to have a license to use medical marijuana. If you use higher doses of THC, that's when you have to get a medical card and become medically, and you have to fit in into certain criteria, which we'll go over so that you can get your medical card. But CBD by itself has got a lot of good properties for anti-anxiety, for seizures, for inflammations, for um, So it does a lot of things to help with inflammation. Actually, it helps a lot of anxiety because they've been noted that inflammation in the body turns on um, turns on anxiety or inflammation in the brain. The brain can see inflammation and turns on a neurotransmitter histamine, which is a neurotransmitter that's associated with anxiety. Too much histamine can cause anxiety, and again, histamine can come in if your brain sees inflammation. So NCBD works on the bringing down inflammation. The way it does this is that when CBD2 receptors come into contact with CBD, it causes a decrease in cytokines, which are little chemical messengers that turn on inflammation in other parts of the body. So it's sort of a, one thing leads to another. Another cannabinoid is THCV. And we're finding they're doing a lot of research currently on this here in the United States. And it's found to be a cannabinoid that helps with PTSD, anxiety. It helps actually decrease appetite. We've used it actually anecdotally, we've actually found patients lose weight on this. That helps with stress eating, anxiety, and it decreases cravings for food. So it actually decreases appetite and it helps with focus. So we found that this is a cannabinoid that is very helpful with that. There's another one called THCA, which is an endocannabinoid that is a precursor to THC, and it's more in the raw form in the plant. So when the plant is actually burnt, it releases THC from THCA, and but it has non-psychoactive properties, so it helps also with inflammation and it's neuroprotective. And then there's other cannabinoids. There's over 100 different ones, but the two main ones in most of the cannabis plants are THC and CBD. Those are the ones you're going to hear the most about. There's ones called CBN, CBG, CBDV. I mean, there's a whole bunch of these. And right now we're just touching the surface on this, and there's a lot of research going on. So this is an ongoing field and it's constantly changing. Right now, the CBD oils that you see, sold as supplements pretty much everywhere are extracts that have mostly only CBD and very little THC, like 0.3%. And so those are considered legal by most standards, And usually people with these type of supplements, it's very important to get a supplement that has that ratio, very low THC, because some of them, if you don't get them from a good source, you can show up positive in urine and blood. So it's not, we sell an actual CBD oil in our that has the 0.3% THC, but it's got a certificate of analysis. So it shows that other companies, it's been measured that it has that much THC by other labs. So it's got the independent lab that checks those levels to make sure they're appropriate with a certificate. Because you can get in trouble. There's been cases where people buy CBD in certain shops and they're not well regulated and has too much THC, and then you don't want to show positive, at a urine test or blood test. But typically we end up having to go into higher THC percentages with people that have anxiety or problems with sleep or pain or inflammation that's not relieved by CBD by itself. And because these two, when they work together, they're synergistically. It's like 1 + 1 = 5 instead of 3 or 2. Here, I can't even add this morning, but yeah, seriously. So that's when you need to have a medical card when you want to increase the THC component, because that one's more psychoactive. That one can cause, if you do too much, it can make you a little bit too euphoric, And you don't want to have too much THC. You always want to balance it out with some CBD, because too much THC can cause tolerance, and your body can become tolerant to it. And then the other component that we see a lot with right now is called terpenes. Terpenes are essential oils that are coming from the flower and the leaves, and they only are released when the plant or the flower is actually burnt, because it releases the aroma. And the aroma in itself is what you smell when people smoke marijuana. And those have therapeutic properties in themselves. So nowadays you can add flour which gives us the full entourage effect. Now you're getting the effect of both, all the different cannabinoids that we talked about, because remember, there's more than just CBD and THC. There's all those CBG and CBDV and all those. You get the full blend of endocannabinoids. Plus, you get the essential oils when you burn it or you vaporize it. You're releasing those terpenes, those essential oils, which you hear about. Like those are the ones that are responsible for lavender and peppermint, and all these other things. They're the ones producing the healing properties, the release of those essential oils or aromas when you burn these things. So, so that combination is very good. It adds more. The terpenes add a different profile to different strains of flower or plants. They these terpenes can add to the effect of the anti-inflammatory effects, the anxiolytic effects, the pain relieving effects, and they're antioxidants. They're also muscle relaxant, and they could be very soothing to the GI system. So now we're talking just a combination of everything, So very beneficial. Uh,
Hey, Doc,
yeah,
early you mentioned that people need to be careful not to take too much because they might test positive if they don't have a specifically medical marijuana card. How, what do you, I know we all know that maybe the laws need to catch up with the times that we lived in, but what can you say to those people that maybe they are holding a concealed permit and they're not allowed to have a medical marijuana card, or maybe they're in a job that they, no matter what, if they have a medical marijuana card, the job is frowned upon.
yeah, that's a good question. I mean, basically, right now, the three big ones that are unfortunate downside to this because the feds are not on board with the states. They right now we have the feds. If you have a government job, you cannot show positive or you can't use marijuana. It can't be on the registry. It's too much of a risk. They don't like that. They consider that still, remember, a Scheduled One. And then, unfortunately, guns. It depends on the state. Some states don't report, gun registries, to the feds. Like some are a little more active in that sense. So it depends on your state. Here in Florida, I haven't seen too much of that. I got quite a few enforcement kind of agents that are retired or they have PTSD, from being at due to their job, and so fortunately they've have been able to get their medical card because the benefits kind of outweigh the risk, and so far they have not had any problems. The feds have much harder things to deal with when it comes to guns and drugs. They don't want to go after people who have medical use. They got much better fish to fry per se. The one that's a big no-no is CDL. If you have a commercial driver's license, that you definitely don't want to be on a registry for medical marijuana because that can cause some drowsiness or some trouble with driving. So and if there's too much of a risk for any company if you have a CDL that unfortunately if you get into an accident you show positive. So but yeah, that shows up on the registry. You could lose your CDL if they find out that you're using marijuana even for medical use. So yeah, there are some caveats you got to be careful with. Just because you have a medical card and a medical reason doesn't mean that you got to take precautions for in different types of jobs, especially government jobs. Not so much with guns. I haven't seen that so much here in Florida. I haven't seen actually not even one case where they take away their guns or um, they may have had other issues going on and they kind of came across that. They really have to be looking for that. But they got more important things to do than that. And then the CDL is a big one. If you're a truck driver, you definitely can't. If you drive for a living, you don't want that on your record. So right now, speaking of those, we mentioned 33 states have now allowed medical cannabis as reasons for using medical marijuana, and one of them is cancer. Cancer. We're going to go about over 9 or 10 or 11 different conditions that most places are considering an indication for, but you still got to check with each state because again, each state is different. And again, unfortunately, the feds aren't on board with this, so you got to check with your state. But for the most part, the ones that we're going to talk about are ones that are considered medically reasonable for having a card. And that you have to generally see us for a consultation. We can see you for a free consultation and see if, based on your medical records, you are a good candidate for medical cannabis. We can do that in our office anytime. And we get you a packet when you come to the office that shows you everything that you need to fill out, and then you come back and we can get you approved within a couple of weeks here in Florida right now. So, but cancer is a big one. Cancer is good because is a big indication for THC because it decreases pain, it decreases nausea and vomiting, which and increases appetite, which we see in patients with cancer, and especially if they're going under chemotherapy, they get a lot of nausea and vomiting, and actually THC has been shown to help decrease those symptoms. So it's also been shown that right now there's a lot of studies going on, but there's quite a few that have shown some smaller studies have shown that it's good at preventing spread of cancer. This THC, and one of the ways it does that is it promotes like the dying off of the cancer cells, and one of the ways it does that is by decreasing what they call circulation or blood vessels from reaching to the cancer cells. So the cancer cells practically starve themselves. So that's something that is very promising. We need more studies, but so far that's something that has been actually anecdotally has been viewed, as a good effect from THC, especially with cancer patients. The other one is chronic pain. Patients who've had been on opioids. This is my favorite use. I mean, it's not, right now the Florida took it away from one of their indications. But unfortunately, it's one of the ones that I use a lot because it does help us wean people off opioids. Opioids are very bad. They cause a decrease in your respiratory centers, and medical marijuana does not do that. You will never get an overdose from medical marijuana. You could get a high that was really bad, but it'll go away, in half an hour, depending on how much you took. But you'll never end up, dying from this where you stop breathing. So the opioid crisis is huge in this country. They're saying that about 70,000 people per year dying of overdoses, and I think that might be conservative. It's the number one cause for accidental deaths right now in the U.S. So with medical marijuana, for the most part, people that are already on opioids, we can start them on medical marijuana and slowly go up and on the dosages, and they can start weaning off their opioids, to much more acceptable levels, because unfortunately opioids also develop a tolerance factor, but there's no tolerance factor in the respiratory centers, and what we call mu receptors in the brain. So as people increase their doses of opioids, they're going to decrease their drive to breathe, which is very dangerous, and that does not happen with medical cannabis or THC or especially CBD, because CBD is not psychoactive. The other thing that I see a lot of people using it for, and a good indication would be inflammation, arthritis. That you can even just use regular CBD. But again, if you add THC, sometimes they're synergistic, so they help each other. But tissues that have inflammation, especially the joints and the muscles, have a high receptors of those CBD2 that we talked about, and CBD likes to hook onto those CB2 receptors and decrease that inflammatory cascade that we talked about. So that's actually one of the very good reasons to use CBD or THC. Unfortunately, right now, arthritis and pain are one of the number one causes for disability and employment for the U.S. So it's definitely a very serious condition that people always think, oh, it's just chronic, but it becomes debilitating over time. And another indication, which is in most states, that it's definitely here in the U.S., is PTSD. I mean, here in Florida, is PTSD and anxiety. Unfortunately, PTSD is caused by a traumatic event that causes patients to have recurrent thoughts and fears, and it causes a lot of anxiety, panic attacks, insomnia. We see this a lot in law officers. People that have come from the VA, they've been through multiple deployments, seen bad things, or first responders, we see that, or just people that have had a bad upbringing, bad childhood memories, things that, unfortunately, it's very common. And and then they've noted scientifically that one of those endocannabinoids, which is called anandamide, is very low in patients with PTSD. So we need to supplement with the plant version, which is THC and CBD. And they found that THC activates or works on these receptors for anandamide. So there's some scientific background where it shows that it does help with PTSD. But again, this is ongoing things. They're doing more research every day. Another thing is another reason to prescribed medical marijuana is glaucoma. Glaucoma has been found, especially to decrease intraocular pressures. The other one is HIV/AIDS. It's very good because it increases appetite and it improves pain and nausea and vomiting that is seen when people use antivirals, the medications to treat HIV. Those have a really high side effect profile that increases, and HIV helps with that. HIV in itself can also cause people to not eat and cause a wasting syndrome. And so this actually helps people eat and decrease inflammation and helps with their some of their symptoms. Seizures is another one. So seizures is the one that's definitely approved in Florida and in most states. And right now, the FDA actually approved it through a pharmaceutical company, a drug called Epidiolex. Epidiolex is primarily a special type of CBD extract, but they made it into a pharmaceutical agent. They've done a lot of studies behind it, and they found that it does help with decreasing, increasing seizure threshold, so it helps prevent seizures. Unfortunately, since it is a drug, it is very expensive. It's like $2,500 a month, and you're better off getting the plant, because you get all of the different, components that, not just one. Multiple sclerosis is another one, decreases muscle spasms, pain, tremors. Parkinson's is another one. The cannabinoids act as agonists for dopamine. So remember, with dopamine is one of the neurotransmitter that is depleted in people with Parkinson's, and they have tremors and all the different things that go with Parkinson's. And they found that THC and CBD, they work on receptors, dopamine receptors, so they're considered dopamine agonists. So, and the good thing is that there's still most neurologists are using, even with conventional drugs, they're okay with the use of this because it doesn't interfere with the medication. Uh, um, and another big one that is being approved in most states is Crohn's. Because Crohn's is inflammation, and again, this helps with inflammation, helps with pain, helps with increased appetite. So as you can see right now, there's a lot of indications, for medical marijuana. Depends on your state and on your symptoms.
Doc, what about people that are struggling? I have another question that came in from the public, but what about people that are struggling with sleeping or struggle to sleep at night?
Yeah, that's actually one that I have found that has been very helpful for patients because a lot of my patients are taking sleep aids or sleep medication, and over time they don't work really good. And if we can add these components, CBD and THC, patients are sleeping very good, very good. They're having good results.
Here's a question from Nan Dolin. How do I apply for a medical marijuana card?
Yeah, again, for the medical marijuana card, just call the office or come by. We can give you a free consultation and just kind of discuss your case, and based on those conditions that we discussed, if you fall somewhere close to those conditions, or sometimes we can actually case by case make it so that if there's like with the chronic people with chronic pain, we can make it so that even though right now they took it off as one of the conditions, we could put it as a different, similar condition to some of the main ones, like inflammation, arthritis, insomnia. If you're having insomnia or pain, or because you have, so basically it's a case by case, and then we need medical records from another doctor to justify, or to, basically. Confirm that you have that condition because we have to submit that to the state when we apply for your card. Mm-hmm.
Awesome, Doug. That was the last question.
Mm-hmm.
Any I know there's still some myth and some pushback on people are not some people are not embracing them 100%. What would you say to people that are still on the fence about medical marijuana?
What I like about this what's great about this is that patient has more control over this. You could use vapors that work really quick, but they don't last as long. You could use oral medication like capsules that take a little longer to kick in, but they last longer. So they, depending on how your body metabolizes, THC, it may not take a effect for like 30 minutes to like 2 hours, but then it lasts 6 hours. When you smoke and you do vaporizing, it happens right away. It's quick. Within 1 minute, you have relief, but it doesn't last as long. So some people can use both. They'll do a little bit of a vape for quick onset, and then for more of a gel cap for more prolonged effect. So what's good about this is that everybody's different. So everybody's accustomed. There's no set dosing for this because everybody's different. So what we do is when we approve somebody for this, we give them just a certain amount of medications that they can use based on what they need. So they're in control of the situation. It's not just one pill fits all. It's very customizable. And the other good thing about this is that it's not. There's different types of THC. There's indica, which is the type of strain of THC that is more relaxing. So people tend to take that more at nighttime and to help them sleep. And then there's another type of or strain of THC that is called sativa, which is more energizing. It's more stimulating, and it's great for people that have problems, focusing or that need uplifting. Sometimes too much sativa during the day can make somebody like anxious, or too much THC can make somebody anxious. You've heard people, well, I get paranoid, but they're not using the right kind or the right combination. And when we're talking about combinations, there's also hybrids, which combines both indica and THC and sativa in one strain. So it's sort of the best of both combined. And within that, you have different. We have sativa dominant hybrids, which you use during the day. So they're more sativa than indica. And then you have more of an indica dominant hybrid that you can use more in the evening that is more relaxing. So as you can see, there's so many ways that you can control your effect, on this. So it's not, and unfortunately, people that do smoke and get this stuff from the street, you don't know what you're getting these days. They're getting altered with fentanyl and other things, to make their drug more potent, and it's not regulated, and they're having bad side effects. So with this, you know exactly which components you're getting, which terpenes if you're going to smoke the flower, and what effects it's going to have. So it's much more calculated.
Hey, Doc, is medical marijuana covered by insurance?
Well, absolutely not. No, because it's not covered by any insurance. So it's all sort of a cash deal.
Nan left a comment saying, "I have severe arthritis in the shoulder and cervical spine knees." That's the one that she asked about applying for the medical marijuana. So basically, she just have to call the office. And just to remind everybody, the numbers for the Brooksville office is 352-596-9095, and the one for Land O'Lakes, for our office in Land O'Lakes, is 813-528-4064. Doug, I don't want to take any more of your time. I know you have a busy morning. Any last thing do you want to say before we leave for today?
Yeah, basically, this medical cannabis is not for everybody, but it's definitely for people who are not getting relief from medications, either for sleep, for pain, anxiety. Again, benzodiazepines for anxiety or PTSD does not work. It makes it worse over time. It's only a short, window where it helps, and then people become dependent. I think this is a great opportunity for you to be in control of your body and your symptoms, and you can actually, research what you're going to put in your body. So it's a great opportunity to help people that are not getting benefits. That's why you have to have medical reasons behind using this legally in the state, especially in Florida is one of them. Have to show that medications are not doing it by themselves.
Awesome, Doc. You share, like always, you share a ton of great information. If by anybody that's going to watch the replays, not watching it live, please leave the questions. I'll make sure that Dr. Moreno gets them. And with that said, I hope you're having a fantastic day so far and a great day. Doc,
Thank you.
see you next time.
Thank you.